Good afternoon, Dr. Sanjay, the chair of the distinguished panelists, the delegates present over here. Good afternoon to all of you. So as Dr. Sanjay introduced me, I am basically as an engineer, as the academics goes, but now I'm in amongst you stalwarts of the medical profession. It gives a lot of kick to understand and to know, to learn the nuances of medical practitioners and practice, especially in the industries. So this conclave or the conference which is going on here is for the practitioners, medical practitioners who are dealing or who are doing with the industries and public at large. So, so presentation is already uploaded, so I'll not take much time giving the background of this. I'll start the presentation, and through the presentation I would like to highlight, or I would like to showcase some of the CSR projects Indian Oil is taking up in the field of healthcare. So before that, so this is, you can see Indian Oil is not doing CSR after the invent or after the CSR law came into 2014. We have been doing it since ages. So last 25 years data, what we have spent on CSR is just showcased here. And the major thirst areas where Indian Oil is contributing to the society is mostly these. And if you can see, the healthcare sanitation is the biggest part or the lion's share of Indian Oil's CSR contribution. Maybe close to 44-45% is the healthcare and sanitation. And it follows with the education and skill development with 33-35%. So close to 75%, 3/4 of the CSR budget of Indian Oil goes to healthcare and education skill development, balanced to other thirst areas as mentioned in Schedule 7 of Companies Act, Section 135 Companies Act. Some, few of the flagship programs which I was talking about related to the healthcare, I'm just showing here. So this is a hospital running since 1906. It's a 200-bedded hospital in Dubey. So taking care of the employees and non-employees around the refinery in Dubey. So if you can see, this hospital, close to 10,000 patients per month is being taken care of by this hospital. Close to 1 lakh beneficiaries come from this hospital in Dubey. Another hospital in Mathura, it's basically hospital for the, it's outside of our refinery, taking care of the destitutes and general public, basically, and it's a 50-bedded hospital, taking care of the chronic or the local health care systems through this hospital. 3 of our refineries are having these mobile medical units. So 12 mobile medical units are running around these 3 refineries and taking care of the nearby stakeholders, villagers. So this is kind of you can say the healthcare to the point of care, to the doorstep of the beneficiary. So this is the story of Indian Oil's contribution to the cancer care, comprehensive cancer care. It starts in 2011 when we contributed close to 66 crores to Tata Medical Center in Kolkata. So phase 2, they were coming up with the phase 2 and Indian Oil contributed to that phase 2. Then, it started the cancer care, comprehensive cancer care in the CSR of Indian Oil. It has been since then. So we have contributed to many other hospitals after this. Sorry. So these are few hospitals, right from Sir Gangaram Hospital to Homi Bhabha Cancer Hospital, which was earlier run by the railways. Now it has been handed over to the Tata Medical Center at Homi Bhabha Hospital in Varanasi, and another Mahamana Madan Mohan Malviya Hospital. So we have contributed for some equipments in that. And we have other hospitals also. We are, it's our vision of the top leader, our chairman of Indian Oil, to contribute close to 300 to 400 crores in comprehensive cancer care in next 3-4 years. So this is all are the footprints of that vision. Disabilities is a major, close to 2.6 crores disabled people are there out of 140 crore people in India. So to support them, Indian Oil with Alimco started to giving these assistive devices, and around, you can see close to 52 crores we have spent so far on these equipments. Madhur Muskan, if you can just correlate close to 14 to 15 lakh, not 14 to 15 lakh, that's another thing. 15 to 20,000, 35 to 40,000 kids, they take birth with this kind of disability, this kind of deformity. And out of that, around 1,500 to 1,600 come from the northeast. So this mission Smile, we have taken an CSR intervention in Guwahati for taking care of Tripura and Assam areas to take care of this surgery. So around 849 surgeries we have done so far in last 3 years. Human Milk Bank. So as we know, for the overall development of the kid, so breastfeeding is very, very essential. So in absence of that, Human Milk Bank is a very, very innovative kind of project, initiative we took in Dharmapuri Medical Hospital, Tamil Nadu. So close to 9,800 women came forward to contribute for this bank. And if we see, around 800 odd liters of milk has been received, and around 3,070 kids have been supported through this initiative. This was other than the healthcare, just wanted to highlight this. So you must have seen while entering the hall, you must have seen this. So we are skilling a transgender community, which is quite disadvantaged position as far as society goes. So this is one skilling development we took with the help of Madras Institute of Technology in Tamil Nadu. Now these transgenders, the first batch of transgenders, they have vocational, they have jobs with Greater Chennai Municipal Corporation. So these are few initiatives we took, which was taken by Indian Oil Corporation during the COVID. This is one of the very historical kind of initiative Indian Oil took. So cheetahs hunted to extinction in 1952 from India. So now, with this historic step Indian Oil has taken to join hands with Ministry of Forest, that through National Tiger Conservation Authority, we fueled this initiative and brought a batch of 8 cheetahs in Kuno National Park, Madhya Pradesh, and another batch is about to come probably in this month, it should come. And close to 60% of the entire financial requirement is being fed by Indian Oil Corporation Limited. So this is the latest initiative Indian Oil is taking up for the eradication of tuberculosis. As the clarion call given by the Honorable Prime Minister, by 2025, TB should be eradicated, eliminated from India. So Indian Oil is taking a step towards helping the Government of India, Ministry of Health, and we are taking up in this in the states of UP and Chhattisgarh. We are providing few equipment and infrastructure, and the facility being provided for active case finding to eliminate tuberculosis from India. Thank you very much.